Hello friends, welcome. And in this video, I will talk about with phobia. What is phobia? Why it occurs? And what are the diagnostic criteria we utilize before we designate an individual is suffering from the phobia? So let me start with this image. What are the phobia stimuli? So all this we'll be discussing in this today's video. So before that, phobia is classified under which type of disorders? This is my question I am putting to you. Yes, it's there on the slide. That is major type of anxiety disorder. It comes under the category of anxiety disorders. You know, we have discussed generalized anxiety disorders. So we'll be discussing panic disorders. Now today is the turn of the phobias. We have discussed obsessive compulsive disorder, the OCD, and we'll be discussing PTSD, that is post-traumatic stress disorders. These are the 5 major types of anxiety disorders, and phobia is one of them. So that is we are going to discuss today. So what is the definition of phobia? NCRT book says that irrational fear. This is the key point, key feature of the phobia. That is irrational fears related to specific objects, situation, interaction with others, and that is the only we known as the phobia. Means we have a fear, but fear has to be irrational. As far as the people is concerned, objects are concerned, some unfamiliar situation is concerned, or you are interacting with someone. It's a very strange thing. That is, fear has no rationality attached with that. Then comes what Coleman says, a phobia is a persistent fear of some object or situation that presents no actual danger to the person or in which the danger is magnified out of all proportions to its actual seriousness. There's the same thing you want to, that the same words has been kept in different perspective or different combination. Same thing, there's irrational fear, that fear from the objects or some unfamiliar situations or some familiar situations, and that fear is out of proportion to the actual danger. What does it mean? Suppose you find a cockroach at your house, so there is no danger manifested by the or given. There is no danger attached to this cockroach, but we get feared irrationally. We get feared out of that, and that is the same. That is in proportion to out of proportion to the actual danger. That is the point I want to make it here, because that the cockroach is a benign insect, and that's not going to bite you. But if it is bites, but bite is not so harmful, but still it produces irrational fear in various people, various individuals, especially the ladies who are working in the working as homemakers. So that creates a fear, type of fear, and that is out of proportion of its actual danger it creates. So that is the definition given by James Coleman, and these are two major definitions as far as the phobia is concerned. And we'll go for the key feature of phobia, which I talked earlier. The fear or anxiety is this circumscribed to the presence of a particular situation or object. Means in other anxiety disorders, there is no anxiety or fear at some place where there is some specific object or situation. As far as phobia is concerned, if there is no object, there is no situation, there will be no fear, there will be no phobia. But it occurs only in the presence of or when individual faces this situation or an object. That is a key feature of the phobia, and that fear has to be excessive one. Getting my point? So this is a key feature of the phobia. Let us go for the introductory part. Phobia is one of the types of anxiety disorders which I told you earlier. It's a kind of fear response. Means we are responding to a situation, and that is our response. Unlike other anxiety disorders, the phobia is related to specific objects, people, or situation. That's the key feature I told you. Phobias often develop gradually or begin with a generalized anxiety disorder. So this is a point to note here. You know, the phobia is a type of anxiety disorder, and generalized anxiety disorder is also a type of anxiety disorder. So the phobia develops gradually. Suddenly you don't have a phobia of any object or situation. In that case, the starting point is generalized anxiety, that we have excessive worry about something, about the outcomes. In that case, that slowly develops into the next higher stage of disorder, that is phobia. And that to be when we come in contact with some object or in the presence of object or some situation. So that is the key feature of that or important point as far as the phobia is concerned. The object of phobia leads to dreaded and mortifying response from the individuals. Sometimes individual gets mortified or so fearful it is that people start trembling. There is tremors in the body. There is so that is the response type of response individual do when they face the object of their phobia. That is phobia stimuli. The people who suffer from phobia have a sense of realization. This is a very interesting point. They know, they realize that the fear is irrational. They know that cockroach or that benign, you call it that there are some spiders. People suffer from the phobia from the spiders. So there is a one earthworm, so benign and so beautiful. No, I can't tell it as a beautiful, but so it's a productive one for the human beings. But we have uh, fear from that, and people realize, those who have phobia from the earthworms or some cockroaches or spiders, they know that they are not going to harm you. Still, they have irrational fears. So that is the point to note down here. Still, they couldn't do anything on it. They couldn't control their fear. They know it. Sometimes the phobia fear is so intense that it can incapacitate the productivity of the individual by interfering various domains of the life. Means incapacitate means your productivity significantly or drastically comes down in the presence of some due to some phobic reactions. So this was the introductory part of the phobia. Let's move to the main types of phobias. You know, there are specific type phobias, specific due to some specific object or situations. Then comes the social phobias, and they are also known as social anxieties, and then comes the agoraphobia. So we'll be discussing the specific social and agoraphobia in our subsequent slides. Now, I'll read out some specific phobias as far as your examination is concerned, and you can know that what types of the phobias are and what they are called. Suppose if there are people they are afraid of, they show the fear when they reach the high places, high building or high trees or something like that. That is known as the acrophobia. Then come from the pain, astrophobia. If you face that, people start worrying, start fearing that there will be pain going to out, and if the idea of the pain comes to their brain, that if someone suffers from that, that is known as the astrophobia. Phobia from the closed spaces, that is a claustrophobia. Then comes the phobia from the blood, hematophobia. Then comes the contamination or germs. There are some people that feel that I will be contaminated by touching something, or the germs may attack me. So if that type of fear, then you may be suffering from the mysophobia. Then comes suppose you are being alone, that is the monophobia. From the night or the darkness, that is known as the nightophobia. Then crowds, ochlophobia. Then disease, pathophobia. Fire, pyrophobia. Syphilis, syphilophobia. Animals, zoophobia. So the names itself is self-explanatory. So take the zoophobia. Zoo, what are you going to see in the zoo? That is animals. Then the syphilis, syphilophobia. These are and one more important that has not yet been included in the DSM-5 or some ICD-10. That is the nomophobia. Nomophobia means you don't have, if you lose the possession of your mobile phone or your cellular phone, and you feel you have some worry that some people may take out my personal information or something, that is going to be in the digital age, we are going to have additional nomophobia, that is known as the nomophobia, means no mobile phobia. That is, yes, it is not authenticate, it has not been included in DSM-5 nor the ICD-10, but it is going to come sooner or later. So these are some specific phobias. Then comes what are the symptoms of the phobia? Though the most important symptom, that is the key point, that is excessive unreasonable and persistent feeling of fear or anxiety triggered by particular object, activity, or situation. That is the point. Someone is in some type of situation, there is some object, someone faces some object. In that case, if there is a excessive fear, that fear has to be prolonged. That is persistent. And the fear has to be irrational one. Suppose if someone suffers from the fear of a tiger, and tiger is in front of that individual, that is not the phobia, that is the actual danger. But if you suffer from the fear from the earthworm, that is actually the phobia. So that is the difference. Then comes the feelings are either irrational or out of proportion to an actual threat, which I explained earlier. That feelings or the emotions or your fear has to be rational, and it is beyond the actual danger presented by the particular object or event. So that is the important one. Then avoidance of object, activity, or situation that triggers the phobia. If an individual try to avoid the objects or the situations that can trigger a phobic reaction, in that case, that is one of the symptoms that individual is suffering from the phobia. Then comes anxiety related to physical symptoms, because there are some physiological symptoms also. Due to fear, the individual they show the phobic reactions. They are likely to suffer from the tremors, which I told you earlier, because there is excessive fear, the body starts tremoring. Then come the palpitations, sweating, excessive sweating, then the shortness of breath, dizziness, nausea. These are the some you call it as a physiological reactions or phobic reactions manifested by the individual suffering from the phobia. And what are the causes of the phobia? This is a very important point. Why the causes that phobia occurs in individual? See, the specific phobia usually develops in early childhood, with the majority of the cases developing prior to the age 10. Because prior to age 10, we people, that is, the child doesn't have adequate reasoning or scientific explanation or someone to help that individual from as far as the phobic stimuli is concerned. So, there is a one part, amygdala plays a pivotal or very, very important role in the innate fear. There was an experiment been concerned where researches where amygdala has been removed from the brain of the rat, and when the rat was placed in front of the cat, there was no fear response in the rat, because rat was standing like a hero in front of the cat, because the object or the component of the brain that induces the interfere was already removed from the rat's brain. So this means the amygdala is the very important brain component that plays a pivotal role in the fear. What are the causes? First, experiencing a traumatic event. If an individual experiences a traumatic event in his life, such type of events or situation can create a sense of excessive fear or then leads to the phobic reactions. Then comes the observation of a traumatic event. Sometimes observing that if an individual had observed some animal biting to other people, or they observed in some accident, that situation can also lead to the phobic response or phobic reactions in the individual. The third one is the unexpected panic attack. That can also lead to the permanent phobic reactions or phobic responses. Then information transmission. This is very important, how that information transmission can create a phobic reaction. Nowadays, the time of today in the digital age, we have the social media platforms, different social media platforms. We are flooded with information 24 hours. So we tend to create a particular type of response to particular situations. So let us comes to that there was a parliament attack on India. And then if we see that the terrorists are firing and killing people, the terrorism is a very big challenge to the India and the world. So in that case, if the information is repeatedly transmitted to the people, so some people might develop phobic reactions or phobic response, and that also leads to the development of the phobia. Then comes the unfortunate experiences, especially the experiential specific phobia. Sometimes individual has some unfortunate experiences, and that leads to the phobic reactions or phobia. Then one of the important part is the genetic factors too. 25 to 65% people when they suffer from the phobia, they are found to be have the genetic component in their causes that why that phobia has taken place. That is 25 to 65%. So this means you have received, there are 25 to 65% chances that you received the phobic responses from your parents as a gift. You can call it as a gift, and that is unavoidable. You cannot avoid that. And then the environment factors, various environment factors also can cause or lead to the phobic response in the individual. So what are the proteins and chemicals or the neurotransmitters responsible for the phobia? I know, and I told you, rightly said that you know that amygdala is an important brain component that leads to the innate fear. So in that case, if there is someone who stops the functioning of the amygdala or inhibits the amygdala, certainly that neurotransmitter will lead to the phobia. So what is one? GABA. That is gamma aminobutyric acid that inhibits the functioning of the amygdala. Certainly it leads to the fear, and certainly there may be the reason the people who are suffering found to suffer from the phobia, they found that this particular neurotransmitter is excessively inhibiting the functioning of the amygdala. Now the second is the dopamine. If it activates or activates the amygdala, certainly it leads to the phobic reactions or fear response. Then comes the norepinephrine, the same neurotransmitter that also activates the amygdala and leading to the phobic reactions or the fear responses. So now what are the risk and prognostic factors associated with the phobia? The first one, specific phobias, remember, are found to associate with cardiac diseases, your respiratory problems, gastrointestinal diseases, then your arthritic conditions, migraine, and thyroid disease. So these, as you see, are the physiological problems or the disorders people likely to suffer when they suffer from the phobia. Means phobia significantly correlates with these diseases. So this is very important. Then impairment in psychosocial functioning and decreased quality of life. So if you have excessive fear from something, some object, and if that's very irrational, certainly if you when you are working something, if that object or the situation occurs there, certainly your productivity comes down, and that is drastically. Then comes impairments in occupational and interpersonal functioning. That's also important one because it certainly creates anxiety, high anxiety, excessive fear, and irrational fear, and leads to the life of disruption in your quality life. Then reduced mobility, especially in the older people. Due to that, they have a fear of falling, and to avoid that falling, they reduce their mobility, reduce their movements, and that leads to kind of a risk. This means the phobia is a kind of risk to such people. So that reduce their social contribution and social functioning. So these were some risk and prognostic factors associated with the phobia. I mean, what is the diagnostic criteria is being utilized that if someone is suffering from the phobia? So the first diagnostic criteria, the first point is individual has to be experienced one, have a proper training and an expert in the field, and they must refer the standard manuals prescribed for the diagnostic. So that is the important point. So first one, the fear or anxiety must be intense and severe. This is the first criteria, diagnostic criteria. And that to be in some presence of some object or the situation. The second one, fear or anxiety should evoke almost every time the individual comes into contact with the object of phobia or face that object. That is only phobic reaction. If someone displays the phobic responses at one or two times, you cannot designate individual as a diagnosed individual with suffering from the phobia. What you have to do is that you have to observe that individual is always responding with the same phobic reactions whenever they comes into contact or in the presence of that situation or the object. So this is the second one. The third one important, fear anxiety should occur immediately as the phobic object or situation is encountered. It is that immediately when encountering that object or situation, individual has to respond with the same phobic reactions, that is excessive worry and fear, or you call it the anxiety. The fear, anxiety, or avoidance is persistent. Means what is avoidance? Avoiding the object or phobic stimulus. That has to be persistent, typically lasting for 6 months. Means If individual is showing these symptoms for almost 1 or 2, 3 months, and then the symptoms get decreased, or there are no sign of symptoms, you cannot diagnose individual with a phobia. That has to be minimum. This is given in DSM-5, that minimum 6 months, up to 6 months, individual has to show these symptoms. That is excessive worry, irrational fear, excessive fear, and that has to be avoidance from this object as low as for the 6 months or more. Then the specific phobia must cause clinically significant distress or impairment in social, occupational, or other important areas of functioning in order for the disorder to be diagnosed. Means this excessive worry or fear has to cause some impairment or distress in your quality of life. Means your quality of life is compromised as far as your occupation is concerned, as far as your social situation is concerned. So that has to be, if individual has to be diagnosed with the phobia. And the last one is the meticulous examination of symptoms and family history of mental disorders. That has to be important also for the clinicians. They must examine the individual before diagnosing with a phobia if there is any medical history of mental disorders is concerned, or there is some genetic factors, or without genetic, that is there is some that same phobic reactions are in their parents or some maternal father, mother, or something else. So that has to be taken care of. And one important note we must keep in mind before diagnosing an individual with the phobic reactions is that their socio-cultural aspects must be considered, because social and the cultural aspects also interfere or also leads to the phobic reactions, or sometimes they also leads to the some different type of reactions. Now we'll be discussing some characteristics of phobia. What are the characteristics? The fear in the phobia is unrealistic and irrational. This was the first characteristic. Means fear has to be irrational, right? You're right, and unrealistic. Then it is persistent and excessive. Means fear has to be persistent, continuously, and excessive. Then the third, the fear causes overwhelming distress in the individual. It causes so distress. Then the reaction to the stimuli is disproportionate. Means excessive one. Individual is not, or the object or the situation is not presenting you with big danger, but still individual considers that there is a very big disproportionate danger from the object or the situation. Then phobia, results from what? Exposure to the objects or the situations. Means that is the 5 characteristics of the phobia. Means if there is an object or situation you find in, and you then it shows some phobic reactions, certainly individual is suffering from the phobia, and that has to be you to take the diagnostic criteria too. That has to suffer from the almost for the 6 months. So these are some characteristics. Now, what are the certain phobic stimuli? DSM-5 and ICD-10 says that there are animals, various animals, that is spiders, insects, dogs, frogs, and earthworms, and all this. So these are the some due to first the journal phobic stimuli is the animals. Due to animals, phobia also develops. And natural environment, that is some heights, storm, water, earthquakes, or something else. So if these are natural uh, activities or natural disasters, or that is comes under the in natural environment. Without disaster also, if you're standing near a very dangerous waterfall and that water is with great speed, in that case there may be individual may develop the phobic reactions. Then comes the blood, due to blood also, injection and injury, such as the needles, invasive medical procedures, surgery. That is also the phobic stimuli. Lots of people fear from the injection. If the moment they see the doctor is coming with that particular needle, that building type needle, uh, and you experience, people experience fever, it is not going to be inserted, it create a big fear in me, and they start trembling and they start crying also. So that is also the type of a fear, but in fact the pain associated with the injection is almost minimal or nil. That also depends upon you, how you take that. Then situational factors, situational phobic stimuli, such as the airplanes. Once people sitting in the airplane and they won't see, look down from the window. Elevators, enclosed places. So these are some certain phobic stimuli. I'll repeat once again: animal, natural environment, blood injection, injury, and the situation. These are the four specific or general phobic stimuli that leads to creation of the phobia. And then finally, we discussed so much thing about the phobia. What is the treatment for that? Yes, phobia can be treated. But the point is, individual has to take the medication and psychotherapy regularly. That is, treatment usually includes some combination of psychotherapy and medication, depending upon the type of phobia, whether it's a social one, whether it's a from the it's a agoraphobia or from some specific one. So, my dear, first one is desensitization or exposure therapy. This is a very important therapy which has been found to be useful in the dealing with the phobia. What do that? It forces the individual, it makes the individual aware, master the individual the fear through some relaxation and other yoga techniques. You know, yoga is very important, the potent technique that can significantly manage, prevent, and reduce your various mental disorders. So we must include the yoga in our daily life, right? Okay. The next is cognitive behavior therapy. You say, sir, in every slide, every mental disorder, you discuss this because this is a very important one. This has found significantly very effective in dealing with the various mental disorders, right? Then comes the third one, medication. Certainly, if the phobic reactions are excessive one, interfering, and that they are more persistent, certainly medications can be prescribed. But remember, psychologists never prescribe medicines. And before taking medications, my dear friends, try this yoga, try various relaxation technique, try cognitive behavior therapy. Because certainly medications, what medications they offer, that is the beta blockers and the antidepressants. Certainly they have some side effects. What are that? That are the sedatives. They have some later side effects. So certainly try for these important and harmless technique known as the yoga, Sudarshan Kriya, Pranayam, and other various techniques. And finally, my dear friends, then the implosive therapy that has been used by the Frankel in dealing with the various type of phobias. So, my dear friends, today the point was phobia. We discussed various aspects about the phobia, characteristics, its meaning, definition, phobic stimuli, the treatment procedures, its how causes, its symptoms, some type of specific phobias. So, these are my references. You can always cross check them. The next topic will be your unipolar disorder. We'll be discussing that. It's a very important one. We must understand that people face very much difficulty in what is unipolar disorder and what are the symptoms causing the treatment. We'll be discussing the next slide. By the time, buddy friends, if you like this video, share with your friends. If you dislike, kindly share your that point why you disliked it with me through my comment box. That is email wamasujit@yahoo.com. In the end, my dear friends, thank you for watching this video.